everyone, I am Dr. Saipriya and I am the General Physician here at S10 Healthcare. S10 Health recently conducted a health assessment program for Kavi Bharathi Vidyalaya. It was a program conducted over 3 days. We had complete support from the staff, the headmistress and the principal. The school is a CBSE based school and it has a lot of innovative ways of learning for students. One of the things that we observed was something called the play-by-way method, in which the teachers interacted with the students through activities and then made them learn the subject. This is very new and was a very good technique because the students tend to retain their knowledge better. The second thing that Kavi Bharathi Vidyalaya emphasizes on is good hygienic practices. So they have good sanitary and air dryers in the school themselves so that the kids are taught proper hand cleaning exercise. When we conducted the camp, we took 2 general physicians, 2 optometrists, 2 dental physicians, and we had our S10 team. At S10 Health, we have a very smooth process of conducting the health assessment camp. We have optometrists, dentists, general physicians, and we also have a vitals checkup. In the vitals checkup, we check for the child's height and weight and we compare it to their age. So we have a child checking 4 parameters, 4 basic health parameters, which helps us assess the overall nutrition and health of the child. At S10 Health, we believe in holistic growth. So we have created and devised a software which helps us manage time appropriately. So the time consumed while doing a health assessment camp is very short because we have computers and tabs on which we put in the data. So all we have to do as doctors is the actual examination and history taking, which makes everything so much easier and simpler for us. So the child walks in, checks their vitals, then checks with the general physician, then checks their vision problems, and then checks their dental hygiene. And all of this data is accumulated and given as a health assessment report for the parents. Because we believe in holistic care, we want the parents to get an actual sense of what their child is going through when it comes to health. So this helps not only you but also us improve so that we know what the child needs for the future. This helps us track your child's health from the beginning till the end. So from first standard till all the way till 10th grade or more. One of the things in our health assessment camp that we stress on is that we make sure that we give appropriate amount of time for each and every child, especially depending on the illnesses that we see. For example, in Kavi Bharathi Vidyalaya, we had a lot of children who had upper respiratory tract infections and sore throats. So we had to advise the kids on how to beat their colds and fevers related to this. The second thing was we gave them a lot of nutritional advice regarding their diet because we noticed that a lot of these children were either undernourished or overweight. So we had to make sure that the kids understood what a good nutritious diet was and also what exercise will help their body. The third thing that we noticed in these children was their mental stress and also the stressful conditions they put themselves under, especially when it comes to examinations. So we had to advise the kids and we thoroughly made sure they understood how to de-stress and how to attack the examinations properly.
Actually, we nearly have to check 1,300 students. All these doctors were just awesome because checking that many students continuously is not an easy job. I can give 100% score to them. I feel very happy with this S10 medical camp. So it went well, and even for the teachers and even for the caretakers for our school, they are just taking for the free of cost. So that is also very good. And for teachers also, they are just telling each and every point briefly and explaining. So all are very awesome.
We had a lot of good support from our S10 team, and because of them, we were able to screen 1,300 students in just 3 days, which was an amazing feat by our team.
Hi, this is Bella John, headmistress at Kavi Bharathi Vidyalaya. Medical camps in our school is usually 2-day affair with teachers writing, preparing individual files for each child and later on penning down long reports to the parents. S10 Health has simplified the process with all the contents digitalized, and we don't have the work of writing the reports to the parents because they can access the reports through the mobile app. S10 Health has also done the screening according to the CBSE requirements and the report is also in the right form.
As we have come across many dental screening camps in and around Chennai, we have analyzed the two major causes for the oral health. So one is the commonest feature is the dental caries, and another one is the poor oral hygiene. When we talk about the dental caries, among kindergarten, it is we call it as a nursing bottle caries. So this is occurs due to the improper feeding habits. Another one is the among adolescents, we call it as usual as dental caries, and it is due to the overconsumption of sticky foods. So it is all due to the poor maintenance of the oral cavity, and it is all because of the improper brushing technique.
And next is prevention of the oral hygiene. So it includes the brushing technique, which is of two types. One is vertical. The anterior most teeth should be vertically brushed. Most teeth should be orbitally or should be brushed in a circular motion. So by maintaining and by taking these steps, it can be prevented and the oral health can be more properly improved. Have a good oral health and have a beautiful smile every day.
As we have done a vision screening camp, we found that major of the students have refractive errors and strabismus, which is not seen through them. So for these cases, they can go for optical correction, that is contact lens or spectacle correction. So in order to avoid these things, we are doing an awareness program. Students to continue their glasses properly, so a teacher should note it down whether they are seeing the boards regularly, and so that they can inform to the optometrist, and then so that we can check them regularly. And one more thing is their proper nutrition levels should be maintained, that is vitamin A should be taken properly for them. Check every year to see clearly. Thank you.
I am Mrs. Lola Shivshankar, Principal of Kavi Bharathi Vidyalaya, Tiruvachchi. When I came to know about S10, I started going into the details and I saw that the assessment included HPE. So I was really very happy. Our children went for the workshop and our teachers also went, and they understood how a test has to be conducted. But I think recording, having that, it was very difficult how to monitor. So I got a very easy way when I saw S10. I immediately said, yes, we'll go ahead because let's try it out. So that's how we went into it, and they are doing everything is online. So a tab has been given, all the measurements and all testing, all the results are being marked, are being entered in that. So I'll be getting a digital report. I think that's great. So it's a great initiative by S10 for us to help all the CBSE schools. Coming up with the health camp. Every year health camp, as you know, is compulsory for the CBSE, and we have to arrange for a day, take a lot of teachers help to coordinate. We have a committee people will do all the work, planning starting from creating the card to lunch to taking care, sending the children. A lot of work is involved. Now here it was very simple for us. They had organized all, it was all again online, and now they will have their health card with them in the app. So it will be easy for them to monitor, help their children, so that we have a healthy students of Kavi Bharathi. I'm sure all the parents will cooperate, and they will keep updating them and taking care of their children. Thank you.